Hello, my name is Anika Anas, and today is November 20th, 2025. The topic of my presentation is carbohydrate and its physiological significance. Carbohydrates are far more than just the dietary staples. They are the molecular engines that power every heartbeat, every thought, and every movement. From the glucose that fuels our brain to the glycogen stored in our muscles, carbohydrates play a central role in maintaining the physiological balance and supporting the metabolic demands. In this presentation, we will explore the carbohydrates not just as the nutrients but as the dynamic molecule with the profound structural, functional, and clinical significance. We will now uncover how they serve as a primary energy source for the cells, participate in cell signaling and recognition, influence the hormonal regulation and metabolic pathways, and impact the conditions like obesity, diabetes, and metabolic syndromes. Understanding the carbohydrate is essential for grasping the intricate web of human physiology and for unlocking the strategies to manage the health and disease. Every cell, tissue, structure, function, metabolic, clinical relevance. Every cell, tissue, and organ in the human body is a masterpiece of design, where structure dictates the function and function drives the metabolism. Today, we will explore how these three pillars form the foundation of the body's physiological and clinical medicine. Clinical relevance. As in the heart failure, structure remodeling, hypertrophy alters the function and increases the metabolic demand. In cancer, the abnormal cell structure and function hijack the metabolism. With obesity and diabetes, excess nutrients overwhelm the metabolic pathways, impairing the insulin signal and organ function. With the neurodegeneration, structure protein misfolding like amyloid disrupt the neuronal function and energy metabolism. Understanding the this triad help the diagnosis, treat, and prevent the disease. So, structure, function, and metabolism are not isolated. They are the continuous narrative in clinical practice. Recognizing their interplay transform how we understand the health and disease. Functions of carbs. This slide visually walks us through the metabolic journey of carbohydrates in four key steps, highlighting their physiological significance. Digestion. Carbohydrates begin their role in digestive tract where complex carbs are broken down into the simple sugar, primarily the glucose. Absorption. These sugars are absorbed into the bloodstream, becoming the blood glucose, the body's primary energy currency. Cellular delivery. The hormone insulin acts as the gatekeeper facilitating the transport of glucose into the body cells where it can be used immediately. Energy use and storage. Cells either use glucose for energy or if it is in excess, store it as a fat for the future need. The classification of carbohydrates. Carbohydrates can be classified based on their structures as the mono, di, oligo, or polysaccharides. Monosaccharides are the simplest carbohydrates, typically with the 3 to 7 carbons. The most common hexose are the glucose, fructose, and galactose. All have the 6 carbons but differ in structure. Glucose is the body's main energy source. Fructose is a sweet sugar metabolized in the liver, and galactose is a component of the lactose converted to the glucose for energy. They are the simplest carbohydrates, cannot be hydrolyzed into the smaller sugars, can be classified based on the carbon number, trioses, pentoses, hexoses, and the functional group aldoses with the aldehyde and ketoses with the ketones. They serve as energy source building blocks for the disaccharide like sucrose and lactose and polysaccharides like glycogen and cellulose. Disaccharides are carbohydrate composed of the two monosaccharides linked as a glycosidic bond formed through the condensation that releases the water. They can be broken down back into the monosaccharides by adding water. They provide energy, act as a transportable sugars in plants, and serve as the structure functional roles in animals. Sucrose is the major dietary sugar, rapidly metabolized into the glucose and fructose. Lactose. Critical in the early nutrition, lactose intolerance arises when the lactase enzyme is deficient. Maltose, important in the brewing and digestion, formed during the enzymatic breakdown of the starch. Polysaccharides. Polysaccharides are large carbohydrate polymers made of the repeating monosaccharides. They are created by the condensation reactions forming the glycosidic bond. Insoluble in water, not sweet, can be branched or unbranched. Their role is to store energy, maintain the structural integrity, and biological recognition. Starch are the major dietary energy source, breakdown by the amylase into the maltose and glucose. Glycogen. Glycogen is the stored in the liver and muscles maintain the blood glucose and fuel activity. Cellulose provides the rigidity to plants. Human cannot digest, but it aids the gut health. Fructans act as the reserve carbohydrate in plants, prebiotic effect in the human diet. Galactans are important in plant cell walls and extracellular matrices. Now the extracellular space. Let's have a quick look at a cell membrane, which is the phospholipid bilayer with the embedded protein. Glycoproteins, proteins with the carbohydrate chain, and glycolipids, lipids with the carbohydrate chain, extend outward from the membrane, playing the crucial role in the cell recognition, communication, and stability. Glycoproteins are carbohydrate chain covalently attached and function as the cell recognition for the immune system, bind hormones, neurotransmitters, or signaling molecules, help cells stay together in the tissues. Glycolipids are carbohydrate chain attached via the glycosidic bond and functions as the membrane stability by forming the hydrogen bond with the water stabilizing the bilayer. Act as an antigen, example the blood group determinants, pathogen interactions, some viruses and bacteria bind to the glycoprotein, glycolipids to enter the cell. Metabolism. Carbohydrate metabolism encompasses all biochemical pathways that manage the breakdown, synthesis, and storage of the carbohydrates. The central molecule is glucose, which is either oxidized for energy or stored for the later use. Key pathways in carbohydrate metabolism starting in the mouth by the salivary amylase and further by the intestinal enzymes. Glycolysis is the breakdown of the glucose into the pyruvate, occurs in the cytoplasm and produces the ATP and NADH. Citric acid cycle or Krebs cycles causes the oxidation of the acetyl coenzyme A derived from the pyruvate, occurs in the mitochondria and generates the NADH, FADH2 and carbon dioxide. Oxidative phosphorylation uses the NADH and FADH2 to produce the ATP in the inner mitochondrial membrane and produces the majority of the cellular ATP. Gluconeogenesis is the synthesis of glucose from the non-carbohydrate sources which occurs in the liver to maintain the blood glucose during the fasting. Glycogenesis is the conversion of glucose to glycogen in the liver and muscles to store the energy. Glycogenolysis is the breakdown of the glycogen to glucose in the liver and muscles to release the glucose for energy. Pentose phosphate pathway produces the NADPH and ribose sugars in cytoplasm to support the biosynthesis and antioxidant defense. Clinical correlations. Impaired insulin function affect the glucose uptake and metabolism causes the diabetes mellitus. Genetic defects in enzyme disrupt the glycogen metabolism, causing the glycogen storage disease. Low blood glucose can occur due to the excessive insulin or fasting. Diabetes mellitus is a chronic metabolic disorder characterized by the hyperglycemia. It is caused by the insulin resistance in the peripheral tissue, mainly in the type 2 diabetes mellitus, or by the beta cell dysfunction in the pancreas, with more than 600 genetic variants affecting the insulin signaling, glucose transport, and beta cell survival. So, if a person complains of the constantly reaching for the water, unable to quench or quench a persistent thirst despite drinking more than the usual, they find themselves waking up by the multiple times at night to urinate. Their clothes begin to hang loosely, even though they haven't changed their eating habits. Along the side, it is a deep fatigue sets in. More than just the tiredness, it is a kind of the weakness that makes even routine tasks feel overwhelming. Vision starts to blur, making the reading and driving difficult. Cuts and scrapes that once healed quickly now linger, and even minor wounds seem to take forever to close. These slow healing sores become a source of concern, and especially when accompanied by the frequent infection, skin irritation, gum inflammation, and recurring the vaginal infection. The skin becomes dry and itchy, constant discomfort that no lotion seems to fix, and then there is a tingling neuropathy, a strange numbness in the hand and the feet like pins and needles that never quite go away. These symptoms, common to the both type 1 and type 2 diabetes mellitus, often creep in gradually. In type 1 diabetes mellitus, they may appear suddenly and severely, especially in the younger individuals. In type 2, they often build over time, sometimes unnoticed until complications arise. But together, they paint a clear picture of body struggling to regulate the blood sugar, a silent signal that sometimes deeper as it plays. Disease progresses. Insulin resistance develops silently, often years before diagnosis. Muscles, fat, and liver cells respond poorly to insulin. Pancreas compensates by producing more insulin. Blood glucose remains normal as it's a pre-diabetic phase. Over time, the pancreatic beta cells become exhausted, progressive loss of insulin secretion capacity. At diagnosis, the 40 to 80% of beta cell function is already lost, leads to the persistent hyperglycemia. Intensive lifestyle interventions, diet, exercise, weight loss can be restored the glucose control. Pharmacological therapy, example, GLP-1 agonists, insulin sensitizers may reverse the early dysfunction. Remission is possible, especially in early stages or post-bariatric surgery. Type 2 diabetes mellitus is a progressive but the modifiable disease. Early detection and intervention are critical. Preserving the beta cell function is essential to the long-term management. Complications. Retinopathy, damage to the retinal blood vessels can lead to the blindness is a top cause of the adult vision loss. Nephropathy, progressive kidney damage. Diabetes is the leading cause of the kidney failure and often requires a dialysis or a transplant. Neuropathy, nerve damage causing the numbness, tingling pain, especially in the hands and feet. Cardiovascular disease, increased risk of the heart attacks and atherosclerosis. Stroke, elevated risk due to the vascular damage and clot formation. Diabetes accelerates the vascular aging, affecting the large arteries leading to the amputation due to the result from the poor circulation and infected wounds, especially in the feet. Cancer. High incidence of the liver, pancreatic, and endometrial cancers have been reported. Dementia, chronic hyperglycemia, and vascular damage is linked to the cognitive decline and increases the Alzheimer's risk. Now, the other disease is the caused by the carbohydrate is the dyslipidemia. The symptoms of dyslipidemia are most people are asymptomatic with the dyslipidemia until the advanced disease develops. Symptoms usually appear when the atherosclerosis or cardiovascular complication progresses, which may present as chest pain or pressure, which is called angina, due to the reduced blood flow to the heart, shortness of breath, impaired oxygen delivery from the narrowed vessels, heart palpitations, dizziness, and fainting linked to the ischemic or cognitive or congestive cardiac failure. Leg pain when walking, claudication, peripheral artery disease, swelling in legs, ankle, or abdomen is the late stage vascular disease and fluid retention. These symptoms may signal the coronary artery disease, stroke risk, severe lipid imbalance. The process of atherosclerosis begins with the damage to the inner lining of an artery caused by the high blood pressure, smoking, diabetes, or high cholesterol. This tear makes the arterial wall more permeable and vulnerable. LDL cholesterol particles slip beneath the damaged lining. White blood cells rush into engulf the LDL, forming the foam cells. These accumulate into the fatty streaks that the earliest visible sign of the atherosclerosis. A smooth muscle cell migrate to the site, producing the fibrous tissue. A fibrous cap forms over the fatty core, creating an atherosclerotic plaque. Calcium deposits may harden the plaque, making the artery stiff. As the plaque grows, the artery lumen narrows, restricting the blood flow. This reduces oxygen supply to the tissue, leading to the angina, claudication, and organ damage. If the fibrous capsule tears, the body forms a blood clot, which is called thrombus at the site. The clot can fully block the artery, causing the heart attack or ischemic stroke or even gangrene. Organs affected by the lipid disorders. The diagram illustrates how the disorder of lipid metabolism affect the multiple organ systems. At the center is the core dysfunction, lipid imbalance triggering the widespread pathological responses, causing the inflammation, tissue damage, and permanent dysfunction at the almost every organ level. These systemic effects contribute to diabetes, cardiovascular disease, stroke, and organ failure. Causes of dyslipidemia is the familiar hypercholesterolemia leads to the impaired clearance of the LDL cholesterol from the blood, associated with the early onset of the cardiovascular disease. Familiar combined hyperlipidemia causes the elevated LDL cholesterol and triglycerides, most common inherited lipid disorder, increased risk of the premature coronary artery disease. Polygenic hypercholesterolemia, often influenced by the environmental factors such as diet and lifestyle, contribute to the common forms of the high cholesterol in the general population. Secondary causes like obesity, especially the abdominal fat, increases the insulin resistance and alters the lipid metabolism. High intake of the saturated trans fat rises the LDL cholesterol and triglyceride. Sedentary lifestyle lower the HDL and promote the weight gain. Medical conditions like type 2 diabetes, again insulin resistance lead to the high triglycerides and low HDL. Hypothyroidism reduces the LDL clearance and rising the cholesterol levels. Chronic kidney or liver disease disrupt the lipid processing and clearance. Polycystic ovarian syndrome, hormonal imbalance contribute to the elevated LDL and triglycerides. Other contributing factors like alcohol use disorder raises the triglycerides and damages the liver metabolism. Certain medications such as the steroids increases the triglycerides and LDL. Beta blockers lower the HDL level. Antiretrovirals and hormonal contraceptives alter the lipid metabolism. So, managing the lifestyle and underlying conditions is essential to reducing the cardiovascular risk. I will end my presentation by saying that eradicating the diabetes and dyslipidemia would unleash a global wave of the vitality, innovation, and equity. A future where metabolic health is no longer a barrier to the human potential. I appreciate you took time to listen my presentation. Thank you.